Hello, everyone, and welcome to Atlantic Coast Aesthetics. I'm Matt with ACA. Today, we are joined with the founder, Dr. Thomas Pane. Dr. Pane, thank you for joining us today.
You're welcome.
Now, today we'll be talking about your background as a surgeon and what inspired you to start Atlantic Coast Aesthetics. We also have questions from our Facebook audience. So now, Dr. Pane, you're a double board certified physician, plastic surgeon. To the folks out there that are not familiar with board certification, maybe you can talk about that and explain it a little bit.
Yeah, after completing a residency in a surgical specialty, one becomes eligible for taking examinations to become certified in the field. It gives a little extra assurance to the public that the person has completed the proper training and done the things necessary to achieve that distinction of board certification. So I have that in my main specialty of plastic surgery, and I also obtained it in my core specialty of general surgery, which is the first residency I had done.
Excellent. And now, Dr. Pane, your surgical residency started out at Bay State Medical Center. Can you tell us about your early days as a physician and what inspired you to start your own practice?
Well, I completed my first residency in Springfield, Massachusetts, affiliated with Tufts University. And from there, I went to Detroit Medical Center, affiliated with Wayne State University, did an additional 2 years of plastic surgery training. I had practiced in New England for a short time and then relocated to Florida. And I had some exposure to some different plastic surgery practices in Florida. And I felt that by founding Atlantic Coast Aesthetics, I would be able to give patients an attentive experience and provide them with access to high quality care in a variety of different fields and be able to control kind of their overall experience in a way that's not easily done with certain other practices.
Well, thank you for sharing your background with us. Now, let's jump into some questions from our Facebook audience. Question one is Lisa from Miami. Lisa is asking, my under eye area is my biggest problem area. First of all, the skin under my eyes are starting to form those creases that pretty much advertise you're getting older. Also, they're pretty dark underneath. And finally, the area of skin from right under the eyes down to where the cheeks start is so noticeably thinner than the rest of the skin. Pretty much what I'm asking is, what are some really good cosmetic procedures available to make the under eye areas look more youthful?
That's a good question, and it's a very tricky area, actually. The under eye region, depending on the person's age, any previous things that have been done in the past. You know, there's things like eye creams and cosmetic topical things that can be done when people are on the younger side. If there's not a lot of skin excess or forward bagging of the fat pockets, forward bulging of the fat pockets, then treatment with fillers, very carefully done in that region, can improve the area. And if there's a lot of extra skin or forward bulging of the fat pockets, then surgical treatment is generally best with what's called a lower blepharoplasty. Sometimes the fat in that region can be repositioned to kind of improve the shadowed area. But that's a good question.
So Lisa definitely has some options, and her best bet is to contact a qualified physician, surgeon to explore those options.
Exactly.
Great. Well, the next question, we have Tim from Arizona. Tim is saying, okay, so I'm a guy who's considering getting a nose job, eye lift, and mole removal of the face. Would it be better to schedule all procedures at once or to separate them?
For that kind of a combination, I would say doing that at the same time makes a lot of sense. The eye procedure and the nose procedure, neither one is particularly painful to recover from. They can be a little irritating because they're both on the face, but by combining the procedure, you have one recovery, one period of downtime, and as long as the mole is not immediately located where in the surgical field of each of the other procedures, then that typically can be done at the same time. And then you have one recovery to get back to your normal routine, as quickly as possible.
Excellent. I think that answers Tim's question. And then finally, we have Sarah from New York, and Sarah's asking, what is a mommy makeover?
Mommy makeover, that's a procedure that tries to restore the appearance, the pre-pregnancy appearance of the breasts and the abdomen. The most common kind of mommy makeover, some kind of breast procedure and some kind of abdominal procedure. With pregnancy, the skin envelope of the breasts and the trunk, torso all stretch out. If there's breastfeeding that's going on afterward, that can also lead to breast enlargement. And when that stops, the skin may be looser than it was before. Sometimes there's not much sagging of the breast, but there's a little bit of a loss of volume. So the breast procedures could involve a breast augmentation, could involve a breast lift, sometimes both procedures. For the abdomen, it could involve liposuction if the skin is not greatly stretched out. If it is, then typically some sort of tummy tuck is also something that can be added to restore the abdomen to the appearance of the pre-pregnancy result. And the other kind of mommy makeover that I do, not all surgeons do, involves some of the gynecologic procedures. If there's vaginal laxity or stretching of the labia minora, that can be done as well. I don't typically combine that procedure with abdominoplasty, but I often do it together with a breast procedure.
Once again, your best option is to contact a qualified surgeon to get a consultation and to explore your options.
Yes.
Excellent. And thank you, Dr. Pane. We appreciate your time today. And if you have any questions for Dr. Pane, please visit our Facebook page, Atlantic Coast Aesthetics, or visit the website, www.acplasticsurge.com. That's www.acplasticsurge.com, acplasticsurg.com. We'd like to thank everybody for tuning in this week. Have a wonderful week, and we'll see you next time.
Thank you.